So the reason we use exosome as a liquid biopsy is because when we look at the liquid biopsy space, most of the assays, whether it's cell-free DNA, RNA, other markers, they typically we use, total blood, total plasma, total serum, and those tests are quite good in terms of their sensitivity. So you can capture these nucleic acids very easily in total blood, but the concern comes always when we try to develop a blood-based liquid biopsy is how do we know that this microRNA or a RNA or DNA signature we're looking in blood came from a particular organ, pancreas in this case. So specificity is always a concern because we are looking in blood. So how do we know the signal we originally originated from pancreas in this case? So that's why we purposely looked at exosomes, because we know that the cancer cell release a lot more exosomes when they're growing and when their disease is progressing. So we purposely looked at all microRNAs in blood so that we have high enough sensitivity. But at the same time, we looked at cancer-released exosomes so that then we can open them up and see what is inside, because that will address the issue of specificity. And eventually, we combine the two together. So we combine exosomal signature, total blood signature, and came up with this assay, which basically is a perfect combination of both sensitivity and specificity. So pancreas cancer is, as we know, is quite lethal. The 5-year survival is still very poor. Only about 10% of the patients live up to 5 years. Most die within the first year. 90%, almost 85 to 90% of the patients, when they're first diagnosed with pancreas cancer, they don't have something we call it resectable cancer, which means the surgeon will not resect the cancer because the disease is already outside of pancreas. So which means only 10 to 15% of the patients have a chance of getting an operation to remove the cancer. So 90% of the patients cannot undergo surgery, which means if you cannot surgically remove the cancer, these patients they can't be cured because the disease is elsewhere. So, and there is a clear link between staging of the cancer and outcomes. So a stage 1 cancer patient can live 5 years easily, or most of them will, more than 40%, 50% of them will live more than 5 years. But if you have advanced cancer, only about 3% of them live 5 years. So the numbers match. So that's why there is a huge interest that if you can find early stage cancers, you can help these patients because they will have 5-year or much longer survival. Many of them, these can be operated on. You can surgically remove the cancer, and these patients, probably some fraction of them can be cured, and many of them can have much longer survival. So in terms of treatments, the treatments we use, they really have not made that big of a dent in the last 2, 3, 4 decades. Yes, the survival has improved slightly. It used to be about 4 or 5% over 5 years. Now the numbers are about 10%. But still, most of these patients do not live 5 years. And there's data to suggest that if we can give the same treatments we have to earlier stage patients, they will do much better. So the reason for early detection is twofold. One, to find the cancer early enough so that we can operate on the cancer, take it out, and hopefully these patients can be either cured or they can live much longer. The second is, even if they can't be operated on, but we can find the cancer early, they can give the treatments which we have, and then these patients probably will do much better compared to if we find the same disease much later. So CA19-9 is a glycoprotein which we use in the clinic on every patient who comes with pancreatic disease, not just cancer, but anybody who has any pancreatic issue, they undergo CA19-9, which is the standard of care. Not for diagnostic setting, but it is just one of the tumor markers we use in the clinic on everybody. So that's why we decided that would there be any added benefit of combining our markers along with CA19-9, because this data is always available to everybody. All clinicians have that. And that's exactly what we found, that when we combined our exosomal markers along with CA19-9, there was a gain in overall diagnostic accuracy. So even for stage 1 and 2 patients, when we combined our markers along with CA19-9, the accuracy was about 97%, which is amazing for a blood test, even in stage 1 and 2 patients. For stage 3 and 4, the numbers were even better. So that is the advantage of combining CA19-9. So was it unexpected? Yes and no. We know that CA19-9 is not a diagnostic marker, so we were somewhat surprised that it does actually work quite good when we combine our marker with CA19-9. That is one. The second is about 15 to 20% of patients who have pancreatic cancer actually do not express CA19-9. So that's a problem, because these patients will be checked in the clinic and their CA19-9 values are 0. So the doctor will think they don't have cancer because CA19-9 is missing, but that is not true. These 15 to 20% patients do not have CA19-9 to be seen, but our test can actually pick up those patients very, very effectively. So it is a much better test than CA19-9 on its own. But in those who don't express CA19-9, that is probably the only test out there, because we have nothing else to offer these patients. Yes, so the next steps for these markers is to continue to evaluate them in prospectively enrolled patient cohorts. So we are doing clinical trials in prospectively enrolled patients to see how do these markers work. And these trials will be done not only in US, they'll be done in multiple parts of US to capture different ethnic and racial groups. We know that certain ethnic and racial groups in US have disproportionate incidence of pancreatic cancer, specifically African Americans. So we're going to be focusing heavily on that as well, to look at different ethnic racial populations within US. So that would be another emphasis. And in addition to that, we'll be looking at geographical populations from Japan and Korea as well. So our goal is to look at all different ethnic groups in US. So we have 9 different sites within US where we'll be looking at these different racial groups. In addition, we'll be looking at populations from Japan and Korea as well, to ensure that these markers do work across global different ethnic racial populations.